obsessions are intrusive or unwanted thoughts, feelings, or urges that people experience as distasteful, disgusting, anxiety-provoking. So it's really this kind of unwanted experience. And sometimes people think that it's only obsession's just a thought. It can certainly be like an image also that could come into your mind. For example, sometimes people might imagine that they've run somebody over and kind of have this flash of an image in their head, or they might also have the thought, I ran someone over. So obsessions can look a couple of different ways. And then certainly there's the compulsion part, which is the effort to mitigate, get rid of, reduce that anxiety because it's so distressful to have that anxiety experience that's triggered by the obsessions. Exposure and response prevention is basically we're going to expose you to the triggers for anxiety. We're going to trigger those obsessions because we kind of need to activate that fear response, that anxiety or disgust response you're experiencing in order to help your body learn that anxiety is normal and this will eventually kind of fade. And then we have the response prevention part. Now this is really key because if you think about it, you're going through your life naturally triggered all the time, right? There's not a day that you probably aren't going through already getting triggered. So you're like, I've got this exposure part down already, but why am I not learning from it? It's really about response prevention. So response prevention is where we come in and we say we're not going to do the compulsions. So again, compulsions are the things that you do in response to the anxiety and the distress that, you know, they're there for a reason. In the short term, it makes you feel good. In the short term, it helps reduce your anxiety, but long term, it prevents you from learning that the trigger wasn't actually dangerous in the first place. So with the exposure and response prevention, we're going to help you set up exposures and to trigger the anxiety, and then make sure that we prevent the compulsions, or sometimes you'll hear them described as rituals, from occurring. So maybe going back to that example I gave earlier, a lot of people tend to connect to this one, is that idea that I have an obsession that pops up, that I have hit somebody and maybe killed them with my car as I was driving by. And so what we might do for an imaginal exposure, for example, is to have them imagine that every time they're in the car that they have hit somebody, and then to not do the response prevention of say, and we'll ask what are your compulsions, what is the things that you're urged to do to make yourself feel better, or to like reassure yourself that things are okay. So you might say, I want to go back and drive my car back over the same path and just double check and make sure, or I want to look in my rearview mirrors. So I might have them practicing imaginal exposures that they're driving and they hear an odd noise, and maybe we'll play some background music, like kind of noise in my office or at home when they're practicing, and they have to imagine that they keep driving past that. Or if we're in the office, maybe somebody will go out and they'll take a drive and we have to do the loop and they can't go back and check. So we're trying to do response prevention there. That's an interesting question. I've heard that ERP alone isn't enough, even if all compulsions are cut out. So I have found that, ERP is the most effective for most of the people most of the time. So as a provider, that's going to be the way that I train. I'm going to use the science to tell me where to start. But everybody is an individual. So there are different therapies out there and different approaches that can augment the therapy or help enhance it. Usually I find that most of my clients really want to start with exposure and response prevention, but again, there are other therapies or other versions that can be incorporated, like acceptance and commitment therapy, mindfulness-based therapies. So there are different ones out there. But again, usually after kind of educating my clients, we'll want to start with exposure and response prevention. But I think it's also key to do response prevention. Mental compulsions are something that people are really good at and don't even realize they're doing. So I've had a lot of clients who have come to me and said, I've done ERP. I got better, it improved, but it never really got me where I wanted to be, so I'm seeking additional treatment. And then when our first couple of sessions, I'll run through with them doing an exposure and I'll quickly realize maybe they're doing a mental compulsion. So then I will teach them a subtle way to try to block that mental compulsion from happening, and all of a sudden they're like, oh, okay, something different happened this time. I didn't do the compulsion. I felt the uncertainty. I felt the anxiety come down over time. So for example, one way that I do that is I'll tell them to say the obsession out loud. It can be a really subtle way of kind of interrupting the brain process, because it's hard to say out loud and think something different. It's too much cognitive load, too much happening in our brain. So if we kind of add that burden of saying it out loud at the same time, it'll be harder to do some sort of internal compulsion, something like perhaps praying to yourself, reassuring yourself, telling yourself that I'm okay, I'm okay. If you're actually saying it out loud, it'll be a little harder to do that. So that might be a way to really try to enhance the exposure and response prevention exercises to get the most out of them. Okay,